Hello everyone. Here I'll discuss about the anatomical features of palatine tonsil and esophagus. First coming to this tonsil. So the tonsils are secondary lymphoid organs. Okay. This primary lymphoid organs are this thymus and bone marrow. Actually this tonsil maintains the mature lymphocytes and initiate adaptive immunity. That's it, it's part of the adaptive immune system. Okay. Here what you're seeing, this is the oral cavity, this is the upper jaw, this is the lower jaw, you can see. This is the tongue is there. See the lateral sides, You can see two facial folds are there. Okay, that is the mucosal folds. This is the anterior facial pillar. See, this is the posterior, you can see posterior facial pillar. This anterior facial pillar is also called the palatoglossal fold. Posterior is called the palatopharyngeal fold. Between those two mucosal folds, the space, this is the tonsillar fossa. There I can see this is the palatine tonsil. So that is the palatine tonsil. Location of the palatine tonsil. Here we are saying this is the sagittal view of the pharynx, you can see. Okay, this is the anterior aspect. See, this is the posterior. This is the base of the skull, vertebra, can see, cervical. Then see, this is the hard palate. This is the soft palate. Nasal cavity leads into this nasopharynx. This is the oral cavity leads into this oropharynx. And the posterior, okay, this view, this is the posterolateral view. You can see this is the anterior, that is the palatoglossal fold. This is the posterior, that is the palatopharyngeal fold. There you can see this is the tonsillar fossa. Okay, there you can see this is the palatine tonsil. Okay. Then coming to the relations of the tonsil. Okay. Here in this figure you can see this is the anterior aspect, see the posterior, see the lateral. Okay, which leads this oral cavity leads into this oropharynx. See the lateral aspect, you can see this is the purple color region, this is the tonsil. See the medial surface, it is forming some crypts, invaginations into the substance of the tonsils. Okay, these are the tonsillar crypts. Okay, medial surface. See, this is the medial surface. This is the upper pole. This is the upper pole. This is the lower pole. Okay, the upper pole is attached to the soft palate. Lower pole is attached to this tongue, and the medial surface is showing some crypts. Okay, see, this is the lateral surface. So lateral surface, there is a fibrous layer. It forms the capsule, that green color area. It's a green color area, that is the fibrous capsule there. Outermost lateral is covered by fibrous capsule. Then it rests on some structures. Tonsil lies over some structures that togetherly forms the tonsillar bed. They're called the tonsillar bed. The structures are, you can see this is the medial pterygoid. This is the medial pterygoid muscle over this ramus of the mandible. Then branches of the spatial artery, glossopharyngeal nerve, submandibular salivary gland, styloglossus. Okay, these are some important structures forming the tonsillar bed. Okay, that forms the lateral relations. Okay. Then in this figure also you can see this the relations of this tonsil. See, this is the upper aspect, upper pole. It relates to the palatopharyngeal arch with muscle. See the lower pole, this relates to the palatoglossal muscle. Medial surface showing some crypts. Those are called the primary crypts. A primary crypt is showing some small divisions, invaginations, that forms the secondary crypt. In the upper aspect, one crypt is deeper. This is the crypta magna. See, that is the crypta magna. Okay. So this forms the structures forming the tonsillar bed. Okay, there you can see the glossopharyngeal nerve, branches of this facial artery, then medial pterygoid muscle, then this one is the internal carotid artery. Okay, these are some important structures you can see over the lateral surface. Then coming to this blood supply. See, the blood supply is through the branches of this external carotid artery. See, this is the external carotid artery. Here you can see lingual artery is providing dorsal lingual branches towards the tonsil. Facial artery, that is facial artery branches. This is the ascending palatine and tonsillar branches of the facial artery. Also is supplied to this tonsil. See, this is ascending pharyngeal artery. That is a direct branch from the external carotid artery. It's providing branches to the palatine tonsil. And also descending palatine branches of this maxillary artery also gives supplies to this palatine tonsil. So that's about this arterial supply. Here you can see this the venous drainage. Okay, see this is the medial surface showing tonsillar crypts, deeper crypt on the upper aspect that forms the crypta magna. Okay, see this is the veins forming this paratonsillar vein. Small veins joins to form the paratonsillar vein that drains into the facial vein. Okay, so venous drainage towards this facial vein. Then here you can see this is a lymphatic drainage. Lymphatic drainage is through the deep cervical lymph nodes, that is the jugulodigastric. Here you can see the jugulodigastric lymph nodes. You can see in the side, upper side of the neck. Okay, so the inflammation of this infection of the tonsil that forms the tonsillitis. Okay, then the removal of this tonsil, that is called the tonsillectomy. Then if the jugulodigastric node gets enlarged and we can palpate, means there will be chronic tonsillitis. Okay. Then here there is the microscopic structure of the tonsil. When we take a section and stain with this hematose and eosin, okay, it appears as here. This is the exterior surface. This is towards the exterior surface. See, that is in line with this epithelia. This is the stratified squamous non-keratinized epithelia. See, this epithelium here. This is the stratified squamous non-keratinized. See, you can see the crypts. So, medial surface, you can see the crypts. Okay, so from exterior to inner. See, deep to the crypts, you can see there are numerous lymphocytes in groups that forms a lymphatic nodule. Lymph nodes you can see. Okay, so here that belongs to the mucosa associated lymphoid tissue. This lymph nodules you can see. Deep to the lymph nodes you can see muscle fibers, muscles also there. Then tonsil, it relates to the submandibular salivary gland. I told the relation of this lateral surface. So it's a mix of this mucus and serous acini you can see. You can mix of the mucus acini and serous acini you can see. Additionally, there are this adipose tissue also there. Okay, so that's about the microscopic structure of the tonsil. Okay, here in this figure also you can see. So this is the lining epithelia, that is the stratified squamous non-keratinized. Deep to the epithelia you can see these are the lymphatic nodules. See the lymphatic nodules. Okay, inner is pale, that forms the germinal center. Okay, here also you can see connective tissues also there. Okay, then deep to that we'll get this muscles and this acini will be there. Serous and mucus acini will be there. Okay, so lining epithelium of the palatine tonsil, that is the stratified squamous non-keratinized. You can see the crypt. This crypt. This is the main significant feature of this palatine tonsil. Okay, that's all about the tonsil. Okay, here next we'll move to this esophagus. Structure of the esophagus. Okay, so esophagus, okay, here you can see it's a muscular tube. See, this is the muscular tube. Extends between the pharynx. Here you can see this is pharynx. This is the lower, this is the stomach. So extends between the pharynx and the stomach. Okay, so this region, this area, that is the esophagus. Okay, see the pharynx here, it is the level of the cricoid cartilage, okay, where the pharynx terminates. Okay, then it continues as the esophagus. See, this is the stomach. This depression here, this is the cardiac depression. This opening here, this is the cardiac orifice. See this opening, this is the cardiac orifice, which lies at the level of T11. Cricoid cartilage, we know it lies at the level of C6, 6 the cervical, and the here that is the 11th thoracic. Okay. Then its length of the esophagus is 25 centimeter. Okay. Here you can see this is the inlet thorax. Okay, this part of the thoracic inlet. Okay, here this is lies at the level of the T4. Okay, so this is the cervical region. Okay, esophagus has three parts: cervical region, thoracic region. Then see the diaphragm will be there. See the muscle diaphragm. Okay, which separates this thorax from this abdomen, lower this part, this abdomen. Okay, so here a smaller part, okay, can see just proximal to the stomach. See here, you can see a small part here, just proximal to the stomach, that forms the abdominal part. In the neck, esophagus is there, okay, before going into this inlet of the thorax. Okay, thoracic inlet, you know the boundaries of the thoracic inlet and all. Okay, just proximal to that lies the cervical region. Okay, cervical part, then thoracic part, and then the abdominal part. Cervical part is 4 centimeter, thoracic part is 20 centimeter in length, abdominal part is 1.25 centimeter in length. That about the extent of the esophagus and its dimensions. Then here you can see this constructions of the esophagus. Okay, esophagus mainly shows three constructions. Okay, here this is the thyroid cartilage. Here there is the cricoid cartilage. Where it begins, okay, it shows some narrowing. That is the pharyngoesophageal construction. Then say this is the arch of aorta. It continues here. This is the descending thoracic aorta. Here you can see this is the trachea, divides into this right and left principal bronchus, where at the level of this aorta, this arch crosses, and where at the level of this left principal bronchus crosses, there the esophagus shows constrictions. Okay, that is the aortic and the bronchial constrictions. See, this is a diaphragm. Okay, it pierces the diaphragm. Okay, then it continues as the stomach. The proximal part here of this, that is the distal part of the esophagus. Proximal part of the stomach, that is the distal part of the esophagus. There it narrows and shows that it is the diaphragmatic constriction. Okay, so that's about the constructions of the esophagus. Then next here you can see the curvatures of the esophagus. See, this is the cervical vertebra. See the cervical vertebra. See, here starts the thoracic vertebra. See, this is the diaphragm. This is the thorax. Here we'll get the abdomen. Okay, this is the lateral view. Okay, so here you can see this is esophagus. This is the trachea, middle mediastinum, heart and the vessels, arch of aorta, descending thoracic aorta. See, the esophagus in relates to the curvatures of this vertebra. It shows andro and posterior curvatures. That about the andro-posterior curvatures. Okay, that is the one towards anteriorly, the lower is towards here, this is the lower part that is towards posteriorly and relates to the curvatures of the vertebrae. Okay, so anteroposterior, two curvatures are there. Okay, then here you can see this the lateral curvatures. Lateral curvatures, first one, the cervical part, this is cervical part, before entering to the inlet at the level of the C7, before entering into the inlet, it deviates to the left. This deviation is not very clear in this. Okay, before entering in the inlet of the thorax, it deviates slightly to the left. Then it forms a one curvature, that is the first lateral curvature. Two lateral curvatures are there. Then the second one, where it deviates to the left again. Okay, where it deviates in the left again, it relates to this descending thoracic aorta to pierce this diaphragm. Okay, again it deviates to the left. That is the second lateral curvature. Okay. Next about the arterial supply of this esophagus. See, this is the arch of aorta, descending thoracic aorta. See the arch, this is the this one, the brachiocephalic, this is the left common carotid, this is the left subclavian. Brachiocephalic divides into this right common carotid and right subclavian. Okay, there is an inferior thyroid artery. Okay, esophageal branches from this inferior thyroid artery is providing supply to the cervical part. See, this is the inferior thyroid artery, esophageal branches. The thoracic part get its supply through this aortic branches of this descending thoracic aorta. Aortic branches of the descending thoracic aorta. So the abdominal part gets mainly through the aortic branches, esophageal branches of this left gastric artery. Left gastric artery. That is about the arterial supply. Here you can see this is the venous drainage. See here. This is the diaphragm, thorax. This is the abdomen. Okay. Here you can see, here we'll get the inferior thyroid veins. Okay, upper part drains into the inferior thyroid veins. Thoracic part, this is the esophagus vein. That is the esophagus vein. Okay, thoracic part drains into the esophagus vein. Then the abdominal part, here we'll get the left gastric veins. Lower part or the abdominal part drains into the left gastric veins. Venous blood flows into those veins. Okay. Then nerve supply, that is the sympathetic and parasympathetic. Sympathetic is from T5 to T9 segments of the spinal cord. Parasympathetic, that is through the vagus nerve. Parasympathetic through the vagus, that is the 10th cranial nerve. Then we'll see the microscopic structure of the esophagus. Okay. Here you can see this is the inner aspect. See, this is the inner aspect. See the outer aspect. When we take in the section, the lumen, okay, the esophagus, that appears like this. Okay, it is folded. Okay, you can see the folded mucosa. Folded. Okay, then there is the outer layer like this. Okay, the layers appears like this. This is the inner layer. This is the outer layer. So inner to outer. So this is from the inner to outer. Okay. The innermost layer that is called the mucosa. So this is the mucosa layer. So this is the fold. I already told inner mucosa shows folds. See the folds. Okay. So the lining epithelium here, this is the stratified squamous non-keratinized epithelium. Stratified squamous non-keratinized. Deep to that, here you can see this is a pale area that forms the lamina propria. That is the lamina propria. Deep to the lamina propria, you can see this pink structure. That is the smooth muscle layer. This is the muscularis mucosa. That is the muscularis mucosa. This lining epithelium, this lamina propria, and this muscularis mucosa. This muscularis mucosa forms the mucosal layer. Okay. So inner layer, that is the mucosa. Okay. Then next we'll get the submucosa. See, deep to the submucosa, you can see numerous glands, mucous glands you can see. See the mucous glands. One is the upper esophagus, the other is lower esophagus. Focus on this upper esophagus. Okay. Then these mucous glands that forms the esophageal glands. They are compound racemose type. Additional to that, in submucosa, you can see the smaller vein. Those are the arteries. These are the venules, and also nerves will be there. Okay. So next layer is the submucosa. Okay. Then next comes the muscular layer or muscularis externa. There will be inner circular, and this is the outer longitudinal. This is the inner circular and this is the outer longitudinal. So third layer, that is the muscularis externa. Okay, that is the muscularis externum. There is the usual arrangement, that is this is the inner circular, this is the outer longitudinal. Okay. Then outermost layer that you can see here, this is the adventitia. See, this is the adventitia. It's made up of connective tissue fibers, this adventitia. Okay. And also you can see here also arterioles, venous. In between this inner circular and outer longitudinal, there also will get the nerve plexus. Okay. So the mucosa, you can see folds, these folds. There is lining epithelia, that is the stratified squamous, non-keratinized epithelia. Okay. Then deep to this mucosa, you can see the lamina propria. See the lamina propria. Then muscularis mucosa. That comes under this mucosal layer. Then we'll get the submucosal layer. There you can see the mainly the esophageal glands. See here, these are the esophageal glands, venules, arteries, connective tissue. Okay, that forms the submucosa. Muscularis externa consists of inner circular and the outer longitudinal layer. Then outermost layer, that is the adventitia. Okay. So we know the esophagus consists of three parts: the upper cervical, middle thoracic, and this is the lower, that is the abdominal. In the upper one third, the muscle layer, that is made up of striated muscles, that are skeletal muscle fibers. In the middle third, we can see there is a mix of the skeletal and smooth muscles. But in the lower third, in this abdominal part, okay, there you can see only smooth muscles. That is the difference of the muscles you can see in this esophagus. Okay. And also the lower part, the abdominal part, lining epithelia is simple columnar. Okay, remaining in the upper and the middle third, lining epithelia is this stratified squamous. As a general structure of the esophagus. Okay. That's all about the features of this esophagus. Okay. Hope you understood about this palatine, tonsil and esophagus. Then you can write answers for this questions in your assignment book. Okay. Describe palatine tonsil. Okay, with the help of the diagrams, you just mention about its parts, its relations, blood supply, then applied anatomy. Okay. Then second is the curvatures and constructions of the esophagus. Okay. You should draw diagrams and then explain curvatures, constructions, extent of the esophagus. Okay. Then comes about the microscopic structure of palatine tonsil. Okay. Tonsil, that is the crypts can see. Okay. Lining epithelium, stratified squamous, non-keratinized. Deep to the crypts will get the lymphatic nodules, everything. With the help of that, use that H&D pencils, hematosil and eosin pencils. Okay. Then next is the microscopic structure of the esophagus. Okay, one diagram is necessary. Okay, they also use that pencils. Okay, where that accordingly that blue and this pink color. Okay, lymphatic nodules you can use that blue color. Okay, that is it takes the hematosil stain. Esophagus microscopic structure from inner to outer, inner mucosa, submucosa, muscularis externa, and the adventitia. Okay, thank you.